On behalf of the team at the Forum for Healthcare Strategists, Jen, Judy, Debbie, Krista, and me, Daniel Nyman, as well as our partners at Monigle, welcome and thanks for fitting us into your busy schedules. We know this time is especially precious as you deal with many issues surrounding COVID-19 and begin to look ahead to what comes next. Over the past 2 months, we've been focused on providing you with real-time information from your expert friends and colleagues across the country. We've turned to some of the best and brightest to talk about what they are seeing, hearing, and experiencing, and to offer advice for addressing the marketing and communication challenges of COVID-19. Today's webinar will focus on Northwell Health's approach to brand leadership through the pandemic. The conversation will be led by Ramon Soto, Senior Vice President and Chief Marketing and Communications Officer at Northwell Health, and Justin Wartell, Managing Principal at Monigle. A final note before we begin. Attendees are participating in listen-only mode, but you can still ask questions. Simply type your question into the question and answer pane located on the bottom of your screen at any time. At the end of the presentation, Ramon and Justin will answer as many questions as time allows. With that, I'll turn the program over to Justin Wartell. Justin?
Thank you, Daniel, and thank you to the forum for the opportunity to jump in here. Have a handful of broader thank yous. Ramon, wanted to say thanks for taking some time to share your experiences and what you and the team at Northwell did.
Pleasure.
And thanks to everybody here on the line who's been able to carve out a little time and join us. For those who are working from home in a suit jacket, tie, and shorts, as this gentleman in the picture, or those back in the office like Ramon, we appreciate not only you finding a bit of time for us today, but also for everything that each of you has done over the past few months, helping all of us to cope and adjust and survive and in some cases even thrive through the course of this pandemic. We wanted to share a handful of things today in terms of our objectives for the session. I want to talk a little bit about the growth and stature around Northwell Health as a result of some of the actions that Ramon and the team took on. I think from our observation, wherever you are in your own COVID-19 planning, there's great learning to be had from a group of individuals and a leader who's been at the leading edge of thinking through how to address some of these challenges. But even as important, if not more important, is then starting to look ahead. And how do we use consumer data in order to drive our decision-making, bringing people back into the healthcare system? And even more importantly, as you've heard from us, if you've ever been a part of one of our presentations before, how do we make it as actionable as possible? How do we put things into your hands that can be most helpful as you go forward, things you can use this afternoon or at the latest tomorrow in making change happen? So with that, I want to pass it over to Ramon to take us through a bit of Northwell's journey and the impact that it's had on the overall stature of the brand and where it's headed into the future.
Great. Thank you, Justin, and good afternoon, everybody. Thanks for joining us. I hope to have a conversation with you. It gets a little boring if we're just speaking at you, so feel free to ask questions throughout, and we'll try to cover as many as we can. A little bit about Northwell Health. So Northwell Health, we are the 9th largest not-for-profit health system in the country, and we are the largest health system in the New York metropolitan marketplace. We service the greater New York area. We are not in New Jersey, we are not in Connecticut, but it's really Manhattan, the boroughs, Westchester, Long Island. Those are our core areas of operation. We have about 72,000 employees. We have 23 hospitals. We have 850 ambulatory facilities. We have 4,000 employed physicians. We have another 10,000 affiliated doctors, 15,000 employed nurses, about 2,000 residents in our system. So we're pretty large. We're about twice as large as our next nearest competitor. And when it comes to COVID, additionally, we're large. There is no other health system that has treated more COVID patients. In total, we're over 14,000, approaching 15,000 COVID patients. And those are inpatient. Those are people who have spent time in our hospitals. We have discharged over 10,000. Unfortunately, over 2,500 have passed away in our facilities. And again, there we serviced about twice as many individuals as our next nearest competitor. And in addition, we have this very unique relationship with the governor. my boss, our CEO, Michael Dowling, he was formerly head of Health and Human Services for the state of New York. That was 20 some odd years ago. And through that time frame, through that relationship with government, he has kept a close relationship with Governor Cuomo. We have acted as an adjunct to the Department of Health for the state of New York, helping them plan, helping them execute. And for example, we co-led much of the state testing and testing facilities that were stood up, at least in downstate New York. And we also co-ran the Javits Center, and we co-ran the USS Comfort in terms of healthcare execution. So a lot going on with COVID. And we're going to spend a little bit of time sharing with you our philosophy. And Justin, if you'd advance the slide. From a marketing standpoint, we took our inspiration from this chart. It looks like a fairly simple chart. This is published by the WHO, and this is principally the disease progression in China. And we looked at this very early on. We stood up our Emergency Operation Command in mid-February. There we were very focused on the operational aspect, but from a communications and planning standpoint, we knew we were going to go through phases of COVID. There was going to be the initial phase, this ramp up, this uncertainty. We were going to peak, we were going to come back down, and then there was going to be this tail. And all that inspiration was really out of the playbook of China that we imported into the United States. So if you adjust it one more slide, please. So this is basically what our playbook looked like. And within 2 weeks of standing up our Emergency Operations Command, we had published our comms strategy. And our comms strategy was principally focused on the 4 phases that I'll illustrate here. The first phase, the surge. Here we saw this initial phase as really the uncertain phase. If you think about the insidious nature of COVID, the stealth-like nature of the disease, nobody knew anything about it, including us. How do I get this? How is it transmitted? What is the mortality rate? If I get it, what do I do? We knew that the market was permeated with fear and that we had to counteract that fear with information. So we very purposefully leaned in and flooded the zone with content, with physicians, with public relations, with information. And within the first week, we launched our Information is Healthy, Fear is Not campaign. We teamed with a new agency of record to create creative. We had radio that literally we did the scripts one evening. We recorded the next day. We were on air the third day in the form of PSAs. We did our first TV commercial, concepted it over the weekend, did the recordings and the voiceover in 2 to 3 days, trafficked, and we were on air within 5 days. And the effort was really to push information into the marketplace. We also unleashed our physicians. So very quickly, media training. We had about 100 physicians that we have in our speakers bureau. We made sure that they were ready to tell the COVID story. And the news media world was really hungry for content to put this thing in perspective. They were just as uncertain as we were, and were hungry to partner with us. So this very aggressive posture in storytelling, because consumers wanted it and consumers needed it. And then lastly, and interestingly enough, this was not the bias of many of our competitors. I won't name them, but a few ran into a little bit of trouble with how they were fighting COVID. One health system in particular, their CEO was had retreated to Florida to manage the actions of its company, of its organization from a remote basis. That really didn't go over too well in the news media, and then that organization really turned quiet in terms of their overall response. And then another organization had some challenges with PPE and some of their nurses being filmed wearing garbage bags. And they in turn became very challenged. So when we flooded the zone with content and information, we were actually very singular in doing that. There were not many competitors who were doing the same thing. If you could advance the slide. So then that uncertainty starts to peak. The numbers start to stabilize. New Yorkers start taking a breath. But believe it or not, we were tired. We had seen, we had peaked at 3,500 patients in our facilities at any one particular point in time. We had added 50% bed capacity. We had added 100% ICU capacity into our health system. Our nurses, our frontline workers were tired and needed to be fortified. We needed to tell the story of resilience, and we needed to get them mentally into a different place. And we looked at this interesting cultural phenomenon where New Yorkers, and frankly, the US was proud of how healthcare stood up during the crisis. You probably saw a ton of B-roll on the 7 p.m. clapouts that took place nationally. And we thought it was a really wonderful opportunity to thank our healthcare heroes. Tap into that social phenomenon that was going on, say thank you to our workers, fortify them, and give a message of hope into the marketplace. So we launched our second campaign, our Thank You Heroes campaign. We called it Project Strength internally. And that was really meant to, again, fortify the message. It ran concurrently with the information is healthy, fear is not, but just another messaging cue that was offering hope into the market. You go to the next slide. So the third phase was the recovery phase. So you start seeing the numbers come down. And how this chart looks is super important. This is not a normal distribution and up and down. This bell curve has a very long tail. And literally our inpatient count kept drifting down. It was not coming down with any degree of speed. At the same time, New Yorkers, and I'm sure this is true nationally, were withholding regular care. We actually saw a 400% increase in non-COVID related deaths for the same period of time. Consumers were still fearful. I don't want to go into that hospital. It's a COVID hospital. And the news media really fortified that effort. So right now we're in the throes of launching our Northwell Safe campaign. So it's very important for us to make sure that consumers understand that we're taking the right actions for them to seek care, to take care of their chronic conditions, to handle those urgent surgeries that they have been postponing at their peril and come back into our institution. And Justin, if you go one more slide. And then the tail is really a new opportunity. So COVID now enters a chronic state. We've stabilized at about 1,000 inpatient individuals with COVID into our institutions. This new world is an opportunity to recognize COVID is going to be with us until there is a cure. And yes, we have to talk about treatments and a cure as part of our research process. But think about this category and think about how healthcare has historically been a low interest category. And because of COVID, it is a super high interest category. All brands are healthcare brands. Every commercial has a nurse, somebody with a mask, is clinically oriented, and they're all saying thank you in some way, shape, or form. How do we use this to reset the relationship that we have with individuals? How do we take the journey with them in this shape of partnerships in a very different basis? So this next phase is for us going to launch actually very, very soon, on Monday actually. It is an integrated campaign. We'll get the message out on how we want to work together with individuals to take this journey with consumers. So the campaign name is Together We Well. That is our new tagline. That'll be in market for some period of time. It'll be a hardworking piece for us. But we have brand permission to have this different relationship with consumers now. So we're going to take that and move it pretty aggressively. So that is the bell curve. Those are the different phases. If we go back to the early phase, go ahead, Justin, next slide. You'll see that the work was very tactically focused, but importantly had to answer very specific questions that individuals had on the personal basis. Hygiene, sanitation, things that feel like a new normal now, 2 months ago were foreign concepts. How long does it actually take to wash your hands? What does social distancing even mean? Should I wear a mask? What is life like in this time of isolation? What if I get sick and I need care? What do I do? What are the processes? How do I get into the ED? What are the access points that are open? When elective surgeries were shut down and consumers didn't have their traditional access points with their physicians, all of a sudden that point of disruption required a tremendous amount of information. So every campaign that we launched was an integrated campaign. TV, radio, print, very heavy digital bias, lot of information on testing, on labs, on patient communications. When you touched us, processes were different. And we had to create that content really overnight. If you go to the next slide, Justin. And then the channels we used, because it was an integrated campaign, were, believe it or not, very heavily earned. The earn piece is on the bottom because it really was the foundation of everything we did. There was an insatiable nature of news media taking content and pushing that out. Radio stations locally were grabbing our content and turning it into PSAs, in some cases without us asking them to. In other cases, purpose-built. Our own channels exploded in terms of growth. Northwell.edu, we get about 20 million visits a year. We're trending at about 35 million visits a year because of COVID and some of the content that we pushed out. In fact, Google did an analysis of our content, and we will now be the official source of COVID content for Google starting in about 2 weeks. And that is for the Northeast. So they regionalize their sources of content. We created new digital assets and new digital destinations for individuals. By the way, we did this on an almost overnight basis. And then on the paid side, as I referred to earlier, all integrated. So infographics, PSAs, patient comms, print campaigns, our own digital assets. The Well is an engagement engine that we use to push out content to consumers. All very well trafficked, all very well utilized. Next slide.
Hey, Ramon, a quick pause here.
Sure.
Just in the spirit of the discussion part of it, a question: did you concept did you concept all 4 campaigns at once, or did you build them over time sequentially before creating the next?
So in the initial phase, the information is healthy, fear is not was purpose built because we had nothing. We were literally starting from a standing start with no content, no information. And so there was a tremendous amount of effort that was put into that component. We knew we had to get to the other pieces because we were going to go through that bell-shaped cycle. So we started work streams to concept the next phases of comms efforts after that initial rush. Remember, the enemy was time, and we didn't have any of it. So we wanted to outpace COVID, get ahead of the curve, and then very comfortably be pushing content out into the marketplace in a regular cadence. So it was a great question.
Great. I'll keep posting them as they come in. A couple of others have been shared, but I think we'll cover them through the course of.
Okay, sounds good.
Today.
Let's jump to the next slide, Justin. So I'm a big metrics guy. I'm sure you all are as well. It's nice to think grand thoughts, but do they produce results? And let's just go through some of the things that we see here. Just to put this in perspective, this is about a month and a half's worth of data. So when you look at it in that short time frame, these numbers, I pinch myself. So on the paid advertising standpoint, we had Information is Healthy and our Project Strength, our Thank You Heroes campaign in market at the same time. You can see what the impressions were for each of the channels, and in total we hit about 238 million impressions for this piece. Fairly healthy for a really a 6 to 7 week flight. I also will say we use brute force to get here. So when competitors were getting shy, we actually we spent money, and we got guidance really early on that content that's COVID related was going to be FEMA reimbursable. So we knew we had to push this out in the market. We peaked at 54% share of voice in the New York market, which is typically an impossible thing to do because it's unaffordable. We typically run at about 12 to 14% share of voice in the healthcare category. So you can see the considerable ramp up in both spending and what we pushed out. Next slide. By the way, I see a question there. What was the most effective medium? For us, digital by far. Actually, Justin, if you go back one, you'll see social there. And if you see the number of impressions on social, consumers were going everywhere for content. They were watching news more, they were reading print more, but they were on social more, and they were sharing like nobody's business. So that was a phenomenon that we witnessed. We have actually a case study here on some of our Facebook Live work that we did, and I'll show you the data there as well. If you go on to the next slide. This is just some screenshots of the TV spots that we did. That first spot, Information is Healthy, literally a 5-day project. And we had Ray Romano do the voiceover from California, which was quite the feat. And then the Project Strength piece. You know, these are not the production values that we wanted. We had to work within the confines of what was allowed. We did have film crews going into our clinical institutions, shooting live video that we were able to use very selectively, but pretty impactful TV. The next slide.
Hey, Ramon, another question. When you think about the production of content, a question coming in, how are you structured to produce content? You want to talk a little bit about the team and diversity?
Yeah, absolutely. So Northwell is a large organization and fairly complex, like most health systems. We're blessed to have pretty good marketing resources. So we have around 150 people in my department. We have about 20 people on the PR side. We have an integrated internal agency that has a team of writers, photographers, videographers. We have a social media team, and each one has content creation capability. So we basically shut everything off and we turned everybody on COVID. And it was really a marshaling of resources on a 24/7 basis, particularly very early on. There were no breaks, days turned into nights. But if you go to northwell.edu and you search on The Well, you'll see the type of rich media content that we were able to produce. And all of that was done on an in-house basis. Let's jump to the next slide, Justin. And then the earned media piece. So you see a number on this page, and you kind of have to pause and do a double take, because I did when I saw it. So we had 172 billion impressions. That's with a B. And the reality is we were on a lot of media. And that media was not just domestically US media. We were picked up globally. So I've seen our content in Russian. I've seen it in Chinese. I've seen our translations of our news media in India. Michael Dowling gets calls fairly regularly from Saudi Arabia. You know, the relationship with the governor was the gift that keeps on giving. So he regularly does his daily brief in one of our facilities. You'll notice a step and repeat with the Northwell logo in the background. And in addition, our co-management of the Javits Center and the Comfort really gave us a very prominent role from a public relations standpoint. So super numbers. By the way, this is audited and this has been triple verified. So it's a big number for like a less than a 2-month time frame. Next slide, Justin. And this is just a sampling of some of the headline work that was pushed out there. All major pubs, all major organizations, the New York Times, Wall Street Journal, Washington Post, CNN, regular contributors on CNN. So again, they were looking, because New York was the epicenter of COVID, particularly in the United States and globally, and Northwell was the epicenter of COVID within New York State. We got our fair share of, probably more than our fair share of attention. Next slide. So, I see a question that came in that says, can you share what you're doing in physician marketing, i.e. referring physicians, digital physician liaison outreach? Absolutely. So we have a physician marketing team. It's about 10 strong. All they do is market to physicians and market for physicians. And we found that the need to keep them aligned and informed was extreme. So here you had dermatologists that were being pressed into frontline service, being repositioned as we closed ambulatory facilities and working on the front line. We found that video communication became a regular and standard mechanism to get the word out. So our deputy physician in chief would regularly have ongoing, multiple times a week, video chats with the entire physician force. And it was an opportunity for them to ask questions. It was an opportunity for him to provide clarity. And as policy was being updated, they were one of the major audiences that we pushed content out to. I'll get to internal comms in a slide or two. Here, this just talks a little bit about the dedicated COVID assets that we put together. So we put together a COVID digital resource center, and the important number is the 1.9 million page views. So this was New York centric traffic, and this was from a start, no content within 6 weeks, about 2 million page views, and over 1,000 pieces of content that were created to feed this thing and feed the marketplace. Next slide, please. Again, a little bit more focus on employees. We can blow by this to the next one. And this is a case study in that that Facebook Live social media presence that we had. So we would do a weekly Facebook Live session, and for the promotion of it, it was marketed actually very little. I think the total budget for these flights, this 5-week flight, was $140,000. We had 38 million impressions there. The real important number is the video views. So 6.2 million unique individuals watched the videos. And this isn't the 3-second pre-roll. This is the 15-second or greater view of the actual content. Again, super hungry, sharing like crazy, and consuming relevant content. Next question. Next page, please. And this is just some of the types of content that we produce. These were infographics. We did this within the first 2 weeks. It was super important that we simplified and made that information very accessible. And then we pushed this out through our channels. Interestingly enough, we wanted to think non-traditionally about how we got this to the marketplace. So we went to our media partner, Horizon Media. They in turn sent this content to their client base, and that client base in turn distributed this content to their employee base. So it was quite an effective means. It's actually interesting when you see this pop up in different states as content that was used from a PSA standpoint. In other places, media organizations would use it, strip out the Northwell logo, and produce it as PSA content as well. So well distributed, a children's version of this was also created and pushed out in the market. Next slide. We're almost done with the numbers piece, and we're going to get a little bit into what the future looks like. Internal comms. Now, these numbers are smaller than all the rest of them, but recognize we're talking about employees. Really, the two numbers to focus on, the emails sent and the open rate. So recognize that 72,000 associates. Where are we going? What are we doing? How are we going to keep them energized and informed? And we created brand new channels. We created this text opt-in process from no employees to within 2 weeks, 32,000 employees signed up. When you got that text, you knew something important was coming through. And it was a very effective medium to get individuals mobilized and aware. The emails that we sent out, you'll see a 50% open rate, and those were hundreds and hundreds of pieces of content. So highly engaged workforce consuming this content. We have a Facebook group that's a closed group that encompasses about 13,000 associates. These are evangelists. These are the Northwell of the Northwell. And they had a 100% increase in posts and content over that 6-week time frame. So very engaged associates. You go to the next slide. Again, this is just sampling of the content creation. Our internal comms team is about 11 strong, and we fortified that with some external resources as well. And we're able to just produce an army of content. Every time we switched over to a new PPE mask, the training content, the training videos, we have an onboarding process for new associates that we had to turn virtual. This team created all that content, video content, who's Northwell, what's it like to work here. Just a tremendous, tremendous impact that this small but mighty team had on the organization. Next slide. So Justin and I are going to transition a little bit here, but we're in this recovery phase now. So COVID, just to give you a sense of the financial impact, the gross financial impact is about $1.5 billion loss for Northwell. That is of a $13 billion organization. And the net impact, because we'll get reimbursements from the federal government and the state, the net impact is about $500 million. So recognize the revenue was shut off, and you'll get federal government reimbursement rates for COVID cases, and the need to fire up the revenue engine is extreme. And by the way, the knock-on effects of this, there's going to be a lot of health systems that are going to be on the ropes post-COVID. So it'll be interesting to see how this process plays itself out. But Justin, if you go to the next slide. So in terms of this, there was, I'm going to tee this up and then I'm going to hand it over to Justin to walk through the data. But as we fired up the revenue process, so we created a parallel emergency operations command. Their sole focus is on how do you slowly turn on the mechanisms of care delivery and revenue through Northwell. We wanted to make sure that we were doing this with a real perspective on consumers, that we had a single source of truth on what consumers were thinking, what were the important issues that we had to address. Remember, fear is it's the baseline of this whole thing. It's these phases of uncertainty. And while we had some anecdotal information on what the consumer mindset was, what were the real issues that we needed to overcome? And we wanted to put together that fact base and offer it up to to our leadership team. So Monigle helped us design the implement, the instrument. We pushed it out in the market. Great results back. I personally delivered the results to the top 200 leaders throughout Northwell. Almost every emergency operations sub-team used that content to create their own playbook on the action items they were taking in the marketplace. And we didn't want to do this on a one and done basis. So we continued to go back into the market. Our next study, the results will be read out to me tomorrow, and then we'll publish it to our leadership team next week. And this has turned out to be just hugely important to guide the organization on where to go. And by the way, the brand permission that we as a marketing organization have to lead, to have a conversation with different groups, whether it's surgery, ambulatory, our ED operations, to help them make decisions. It's really been a source of stature for our own shop to guide the organization. Next slide, and Justin, I'm going to hand it to you.
Yeah, absolutely. When you think about the business opportunity as well as the team opportunity that Ramon was just talking about, we were thinking of this challenge through this framework, starting with the idea of messages and what could we be communicating to help re-engage people, to communicate safety, to address the challenges and concerns on their minds. Then how does that migrate into the protocols and the operational elements, thus giving marketing and brand teams that voice and influence on how we're operating and delivering. And then ultimately the proof points that consumers have to see, have to experience. Messages are what we say, proof points is what we show. And so if you think about saying and showing, we've got to be able to do both if we're going to help to close this gap relative to the opportunities for the business. So in our first wave that Ramon talked about, we focused predominantly on messages on the left side of that story. And we want to share with you some of the data that we collected just to give you a sense of the kinds of information that was helping to guide the decision-making at Northwell. First, we were starting with just building a baseline around the likelihood to delay care in that short term, really getting at the amount of pent-up demand that we're thinking about. What is the opportunity, to frame it that way? And we were seeing still folks very likely, somewhat likely at about 70%, 7 out of 10 in total, with a plan to continue to delay treatment that they might need. Going a little deeper, how do we start to think about the time frame that they're operating within? What's the window that we should be thinking about? So you're going to see two elements brought to life here: primary care and doctor specialist in black, non-emergency surgery or procedures in gray. And you see a difference happening as people are considering whether they're going to engage with their primary care physician or specialist as when compared with non-emergency surgeries or procedures. And this probably maps to what you would expect within each of your local markets. I think it's the size, the 40% level, that's the challenging one here, is how do we help them to get more comfortable? I think that this gets to one of the questions that was posed around how do we start to help people understand what safety means and how we can help to address the feeling of safety as people are walking through the door. To start, we need to look at the origin of that concern. What are those barriers to receiving healthcare? You've got that worry about getting sick, so the idea of contracting COVID-19 as an example, but you also have things like fear of going to a hospital. And this hasn't been lessened any by both from a media standpoint, as well as even in some of our own industry-based communications, talking about hospitals as the front lines and as war zones, creating a perspective for people, or a perception for people that there's reason to fear. Concern about availability of medical supplies, the PPE story there. And then at a lesser degree, kind of tertiary there, unsure about quality, and much less so concerned about cost. When it comes to thinking about the style of communication, I think the work that Ramon and the team did around information instead of fear fits so clearly with what people were expecting from an overall tone from health systems at this time. A real and direct communication, clarity on the factual information out there, we've continued to deconstruct this idea of tone and some of the other similar research studies we've deployed across the country. And that factual, informational, clear, and direct message and tone is exactly what people are asking for pretty consistently in just about every market across the country, as well as from an overall nationally balanced sample perspective. So the more that we can emphasize that realness, that directness, even though our tendency sometimes is to lean toward the more emotive, we've got to make sure that we're being aligned to the type of communications that consumers are expecting from us. A couple of other considerations, again, just to bring to life the nature of the information that we were collecting and providing to the team. What's going to help people to feel more comfortable when they're receiving care? And the focus on safety, it dominates here. That notion of trust, transparency about the situation, fitting very closely with that overall tone. But safety clearly on the mind of the majority of these consumer audiences. But what does safety really mean? And this is maybe an important evolution for some, is to think about it's not enough to just talk about safety. You've got to deconstruct it into really what safety means. And in this case, safety manifested for consumers in this market as requiring everyone to wear masks and protective equipment, followed by reducing contact and clarity of information about protocols and procedures, providing that sense of reassurance. So we have to think about safety, and in a lot of the communications efforts that Ramon was sharing, especially as things progressed, making sure that we're not just saying it, but we're deconstructing it into what influences and guides people's perception and belief of safety. Another interesting consideration here was around people's interest in understanding where patients that were exposed to COVID-19 exposure are being isolated. So it was interesting in this particular area that as it relates to emergency and urgent care, a higher propensity of people wanting to know a bit more, where are folks that have been impacted or exposed to COVID-19? So that I know where, again, in that spirit of safety, that being a cue to what safety really means. One of the other interesting aspects here that Ramon talked about in the way that they activated the physicians across the organization and the large group of physicians that are part of Northwell Health is based on this notion of trust. And as you can see in the scale of trust, probably nothing that'll surprise you toward the right side of the chart, but it was physicians that are the most trusted as communicators or purveyors of information relative to safety of engaging with the health system. And we're seeing this trend pretty consistently across markets in the US as well as nationally. The idea being if we can connect more directly a message from physicians, ideally your local physician or the individual from whom you get care, that it's going to more significantly and more quickly impact the perception you have of safety, of trustworthiness from the organization. The other element that we dug into, and this also connects to the question, so Ramon, I'm going to tee up a question for you that came up in Q&A around the role of telehealth in your marketing strategy. Yeah. But we're seeing a huge increase in people's not only usage due to the fact that many of you have sped up and stood up telehealth operations across your various enterprises, but also that there's a willingness and an exponential growth in people's understanding of what telehealth is. So we've been measuring telehealth. We've been looking at the role of telehealth in the broader experience that we're delivering for people across a number of different markets in the country. And it'll be interesting to see how much we can make telehealth potentially a part of how people are engaging in healthcare in this new normal. So with that, Ramon, a question that came through: how did telehealth impact the way you were approaching your marketing and communications efforts?
Yeah, so first of all, I think the research suggested to us that virtual care is here to stay. And because of the waivers that were granted through COVID, one of the things that's held back telehealth adoption has been the reimbursements. So most organizations that have been using it for follow-up care, kind of lower acuity interactions, a monitoring process for at-home care. And we were doing all that as well, but we had just not scaled it. So it was important for us to recognize that we needed to ramp up from a few hundred physicians that were telehealth capable to, we've now scaled it to over 2,000, and we did that in about a 2-week period. So it was just this huge growth in capability to map the consumer demand. So if you think about it, the formula is in this research. The tactics are in the research. Don't tell me, show me, right? I want to talk to my doctor, but I don't want to go into your place to talk to my doctor. So there's this natural utility that this tool allows that fits into the value equation and how you interact with patients. That was very seamless for us. We had worked on integrating telehealth throughout Northwell from a systemic standpoint, but not necessarily consumer facing. And then we just had to turn the lights on and push that out very aggressively. It is now a key component on how we're going to provide continuity of care and telehealth capabilities. Our request an appointment platform now gives consumers options to toggle on to request a telehealth appointment. We have scaled that as of June 1st. That will be available through all of our physicians digitally. And then on a very targeted basis, we're using patient comms to market. Some of our competitors have used broad media, and I think that is, they're ahead of us in that regard, and I don't want to do the head-to-head thing. So much more on a targeted basis, because we've done so many patient interactions. We've interacted with 6 million unique New Yorkers over the last 4.5 years. We have a fairly rich database of individuals to go out and decide who telehealth would be appropriate for and have a very personalized message with them. But it's here to stay, and it is a key component of how we go to market. It's a great question.
Well, we did see a couple of questions come in relative to the trust associated with physicians. The question around, did we include nurses there? We hadn't. I think it's a great build. And as we start to look at better understanding and deconstructing sources of trust, at least from the Monigle side, we'll definitely plan to add nurses as a capitalization in that
question. By the way, because consumers want to hear from doctors first, health systems or hospitals second, they are the front line in terms of how we communicate. So they will play very prominent roles in our advertising. They call up their patient base. So it's kind of like low-tech telehealth, maybe first-generation telehealth, but literally a phone conversation with Mary Jo Smith, who is deferring urgent care to have the conversation that, hey, look, we're doing these things to make it safe for you to come back into our institution. Let's schedule that visit. You really do need to take care of this chronic issue or this emergent issue.
So as Ramon talked a little bit about earlier in the discussion, this is also just the first wave. Some of the data that we shared, we're reporting out the second wave tomorrow and are in the midst of continuing to collect this data, especially because mindsets are changing so quickly. We're digging deeper into emotional state, impact and influence of media, changing favorability, and people's willingness to switch. I think that's been one of the other interesting evolutions thus far, is the orientation that people have as a result of a lack of trust or a gap in trust to potentially use other providers. So one takeaway that we hope you all have is a lesson, I think, in what the Northwell team took on, which was using this research, using the insights base as a single source of truth, and to help the organization in a way that goes beyond some of the traditional ways that organizations or that healthcare brands have viewed and leveraged their marketing teams. So with that, we wanted to use the last few minutes of the session to get some more tangible examples of what Ramon and his team are doing as it applies to what's ahead. So there are 5 themes that stood out. We'll tee them up, and then Ramon will talk a little bit about what he's doing from a Northwell perspective. we've talked a little bit about this, but just to say to share once again, when you think about safety, it can't be just about telling people what's safe. It's about thinking about the explicit and the implicit cues to safety and proving for people what safety truly means. That starts with understanding how they define it in the first place.
So here we're again using integrated campaign, earned media, paid media to get the message out. But this is all about action. And what action have we taken to make an organization feel safe and be safe? So, we have this wonderful term at Northwell called terminal cleaning. We're going to terminally clean this institution. I think that's a terrible name for cleaning, but what does it mean to have deep cleaning in an institution? And we've actually had news media who've picked up what that means and have published that out. We have physicians doing opinion pieces. We just had one in the Wall Street Journal today about the ED and why it's important to come in. So this is the doc very tactically talking about how it is unsafe to defer care and the need for individuals, if you need care, to come in. We have examples of and really instructions. What PPE are we using? What's it going to be like to social distance in the waiting room? How are we cleaning our institutions differently? How are we treating COVID versus non-COVID cases? Real tactical examples of what we're doing to make places feel safe.
The next one, just in the interest of time, I
know.
tons and tons of examples to share. We've talked a little bit about this, and especially given the scale of which Ramon can leverage from a broader physician audience perspective, but giving physicians a voice, how you empower someone's individual physician or physician voices across your enterprises to be the communicators here and to take on the mantle of how we address not only safety, but also process and what the experience that is expected will be for individuals that might walk through our doors.
And Justin, you've answered this well. I think in this case, it's how do we mass customize this? So you don't want every doctor picking up the phone or doing their own thing. You want to create a playbook. You want to have it probably 60 to 70% prescriptive. This is what we're doing from an enterprise-wide standpoint. That may be the letter that the doctor writes to go out to their patient base in terms of patient communications, or it may be the script that they use to talk to their patient over the phone, or what the initial telehealth program interaction is going to be with consumers, all to revert back to the information you heard in the research to address the specific concerns that consumers have, but to hear it from the authority. Docs are the value creators, and we have this really unique relationship. And now we have more brand permission than ever to have an engaged relationship with individuals. So physicians are really at the forefront of that.
The next three are truly pushes. And if we think about leading the dialogue, leading healthcare as an industry into the future, we've talked about the role of telehealth as an example, as a part of driving new digital behaviors. How do we think differently about our audiences, and even from a segmentation standpoint, those that want to engage and interact from a virtual standpoint, in comparison with or in addition to those who want to continue to walk through the door? This represents an interesting opportunity. How can we grab at what's happening out in the marketplace from a mindset shift standpoint and make it part of our broader notion of experience? Historically, patient experience has been very physical in its nature, focused on what's happening within our four walls. This is an opportunity to kick through the door toward a broader definition of experience, incorporating these new sets of digital behaviors.
So I do think this is forward-looking work, and I do think this is homework for everybody. Just take our own experience. Recently, we had our consumer segmentation scheme, and we had those individuals who had a digital bias. COVID stuck a hand grenade in that. Remember the numbers I started with, 20 million visits on our web assets, now trending to 35 million. So you have new users out of the need to have some utility to get information who are engaging with you in a different way. Who are they? Who are those new adopters? How do you make the process of engagement comfortable for them? And how do you satiate all those who are on the adoption curve at different places? We're investing a tremendous amount in our digital platform. We do 6-week sprints to bring up functionality and really push it out on a real-time basis. We think digital is really going to be a differentiator for any health care organization. An expectation, this virtual world that we're all living in is going to be an expectation of great care in the future. And we believe if we're not ahead of this, we're not ahead of it to our peril.
The other piece Ramon has talked about, and this is pretty straightforward. It's somewhat odd to talk about this opportunistically, but there is an opportunity to reposition the legacy role of a marketing, communications, and brand teams within healthcare as that single source of truth. I think that Ramon talked a little bit about how he's been able to use some of the things that we're learning as guideposts, not just for marketing and communications, but for the decisions being made by the business at the highest of levels. It's a pivotal moment as we think about transforming our team in this new world.
Yeah, so I said this, I was on a CMO call about 2 weeks ago, and we were talking about where marketing is. And the opportunity is basically to tap into and to take advantage of the brand stature that all of healthcare has right now. So we're in this different place, and every brand wants to be a healthcare brand. Now, is that a long-term trend? Is that situational? I don't know, but it's an opportunity to take advantage of that. So I know everybody is going to go through budget challenges, every single organization. Arguably, everybody on this call has a role in making sure consumers are informed, consumers are confident, consumers see your organization as the destination healthcare organization. That can only happen through strong communications and strong marketing. So there really is this door that's open that if you lean into it, you probably can get more resources than less, because it's going to be super important that we're firing on all cylinders very effectively, and that we're driving the most value as we possibly can. And the marketing function is just in this really unique place to connect to consumers in this existing environment. I think that opens doors up. I get invited to strategy conversations with service lines and with physical plants and specific hospitals and regions on a regular basis to help them shape what their go-to-market strategy is going to be. It's a really interesting turn for the marketing organization.
I want to be respectful of time. I know, Ramon, you're headed to a board meeting, and having spent time with members of your board, I don't want to be in the way of keeping you from that. So we'll just hit these last couple at a very high level. I hope one thing that all of you who have spent some time on this webinar have been able to take away is this orientation of thinking bigger. I hear from many of you the excitement and energy and perception around Northwell in that thinking bigger mindset, and hopefully you've been able to take away a few things today that can propel this thinking bigger orientation. I think Ramon's one of the bigger thinkers out there, and hopefully some of the things that you've heard today will help you to propel that mindset going forward as well. I think for us, and I'm sure you've gotten a sense of this, especially when you start to have to talk about impressions in the billions, as Ramon was doing a bit earlier, this is the path to leadership, is that orientation to thinking bigger and seeing opportunities to take that leadership role. And we hope that today you've been able to see a few things that will help guide your own leadership into this new age. We do have a handful of questions that have been posed. I will work with Ramon after today's call to get some of those addressed. Many of you have asked if this will be distributed. The recording and the deck will be. So you'll have access to that. I think we just wanted to leave you here on this last slide. I think we're we're continuing to hear more and more interest from leaders such as yourselves around starting to think about experience and becoming part of a sharing of insights and learnings. We'd like to continue to be able to share some of those learnings with you. So feel free to reach out to us as we start to continue to connect people together and help share some of these best practices.
Yeah, just one more comment on this. So first of all, thank you for inviting me and Justin to help share with you. I am a personal believer that this category needs to be better at what it does, particularly from a marketing standpoint. So I'd encourage you to steal shamelessly. Go to our websites, look at what we're doing. We are trying to be at the forefront of how we storytell and how we engage with individuals, and we'll share more. I do think consumers are better off if we all get better at what we're doing, and we'd love to share best practice with you guys as much as possible. So thank you for inviting me. Thank you for inviting Justin. Great partner, Monigle, fabulous thinkers. Could not do this without them. And I hope you guys enjoy the rest of your day.
Thanks, Ramon. And thanks to the forum once again. We appreciate it. Have a great day.
Guys.